Hello, welcome to VMC. I'm Dr. M. Today we are going to be covering feline specific aspects of dental disease, as they have a few issues that our dogs don't seem to deal with that are a bit complicated and require special treatment. Join me, you'll learn something today. So cats have a couple of unique medical conditions that affect their teeth. The first thing that we're going to talk about are Forealls, or feline odontoclastic resorptive lesions. In order to understand what this is, first I need to teach you a little bit about tooth anatomy. So there's the part above the gum line, which is called the crown. The part below the gum line is the tooth root. Inside of the tooth is the cavity is the nerve pulp, essentially, that does connect to the rest of the body, and that serves for the sensation of the tooth. Then the bulk of the tooth is made up of dentin, and then we have the enamel, and there are also the attachments between the bone in the jaw to the tooth itself. So in a foreall, what happens is the dentin starts to break down and the tooth will start to be resorbed. This can cause a lot of pain for the cat. This can happen to one tooth or multiple teeth in a cat's mouth, and it's incredibly common. It depends which study you're looking at, but say between 20 and 60% of young cats will have a foreall happen, and it's somewhere around 75% of cats that are middle-aged or older that will be experiencing this. And so this is part of why it's very important to carefully monitor your cat's eating habits, whether they are demonstrating any pain with their mouth, like dropping pieces of food or tilting their head because they're trying to chew on one side or the other, or whether they all of a sudden start swallowing kibble whole instead of chewing it, or if they start to prefer canned food over kibble all of a sudden, which would be a change, to their usual. Drooling can also be a symptom, or jaw chattering can be a symptom of pain. So keeping an eye out for all of these things is important. And having your veterinarian look in your cat's mouth at least once a year is also important, because we can start to see reddened gums or enamel issues with the teeth, or pain if we try to look in the cat's mouth. And then those intraoral x-rays are necessary in order to diagnose if the tooth is being resorbed, and if so, it does need to be removed. Otherwise, it just continues to cause pain for the cat, and eventually the tooth will start to break, which causes more pain. So the treatment for a foreall is extraction. It is frustrating because we don't know what causes forealls. Researchers are currently arguing about it, but at this point we don't have an answer. Another condition that cats get that we need to talk about is stomatitis, or gingivostomatitis. This is when the body has an inappropriate immune response to its own teeth or any dental disease that forms on those teeth. And it ends up causing an extremely red gum area, or even like roof of the mouth, the palate. Just the entire mouth can get very inflamed and painful and red and angry. And the good thing is that this is less common than the forealls are. And it's also important to remember that stomatitis can be linked to cats that have FIV, the feline immunodeficiency virus. It's a bit more common in those cats. And we think it's because the immune systems of those cats are already a bit interrupted because of the FIV, and that predisposes them to developing the stomatitis as well. Stomatitis is excruciatingly painful. It is awful, and aggressive early treatment gives your cat the best chance for having this resolve and be managed. And so if you see your veterinarian and stomatitis is being suspected, expect your veterinarian to tell you that your cat needs to lose all of their teeth. I know this sounds incredibly invasive and dramatic, and it often shocks people when their veterinarians tell them this, but it is the truth. When we try to treat this with steroids, or when we try to only remove some of the teeth, what we find out is that the stomatitis comes back and it can be much harder to control in the future. When we promptly do early intervention and remove the cat's teeth, that gives the absolute best chance for that cat leading a happy, pain-free life. And they don't miss the teeth. They tend to just go on no problems once their mouth has healed, and because they're so much less painful, they are incredibly happy compared to when they have the stomatitis and still have the teeth in their mouth. Thankfully, gingivostomatitis affects only 3 to 5% of our cats, but it can happen at any age, and so it's important that if you're starting to see redness in your cat's mouth, that you book an appointment to see your veterinarian promptly. Once all the teeth are removed, then the immune system has nothing left to fight against, and somewhere between 80 and 90% of cats will experience resolution of their gingivostomatitis and not need any further medication or treatment management. There are still going to be a few that will need further treatment, and then that's when we might use some steroids or even like a mouthwash that can help relieve pain and inflammation for the cat. But the big take-home message is that early extraction of those teeth is crucial. And so if your veterinarian is suspecting stomatitis, you need to go for full mouth extractions as early as possible. And it's also important that after the teeth are removed, that x-rays are taken again just to make sure that all the pieces are gone, because if any pieces of tooth are remaining, then the disease will not resolve. And sometimes seeing a veterinary dentist can be wise here, because this is quite a procedure, and a veterinary dentist will be a lot more efficient and have the tools to make sure that every single bit of tooth is out of your cat's mouth to give them the best chance possible of living a pain-free life. While you are waiting for the teeth to be extracted, your veterinarian may recommend a steroid like prednisolone or something like cyclosporin to try to dampen down the immune response and give your cat some relief. Pain management is also crucial, and you can also offer soft foods like canned food would be your best bet here in order to help your cat to keep eating while waiting for the surgery. Well, I hope that you enjoyed learning a bit about cats and their interesting disease processes. We need more research in these areas, so hopefully that will happen. I wish that I could tell you definitive answers for why some of these disease processes happen, but at this point we just don't have them. All right, please leave questions if you have any down below, or comment with future video ideas for me. Make sure you subscribe if you haven't already, and we'll see you on the next one.